Harvoni is a combination of ledipasvir and sofosbuvir and is used to treat chronic long-lasting hepatitis C, a viral infection of the liver. It may sometimes be used with another antiviral medication, ribavirin. This drug works by reducing the amount of hepatitis C virus in your body, which helps your immune system fight the infection and may help your liver recover. Chronic hepatitis C infection can cause serious liver problems such as scarring, cirrhosis, or liver cancer. It is not known if this treatment can prevent you from passing the virus to others. Do not share needles and practice safer sex, including the use of latex condoms to lower the risk of passing the virus to others. Indications. Harvoni is used to treat chronic hepatitis C in adults and children who are at least 3 years old. Harvoni is sometimes given in combination with another medicine called ribavirin. Harvoni treats specific genotypes of hepatitis C and only in certain people. Use only the medications prescribed for you. Do not share your medicine with other people. Harvoni is sometimes used in people who also have HIV. This medicine is not a treatment for HIV or AIDS. How to use. The recommended dosage of Harvoni in adults with genotype 1, 4, 5, or 6 HCV is 1 tablet, 90 mg ledipasvir and 400 mg sofosbuvir, taken orally once daily, with or without food. The daily dosage of ribavirin is weight-based, 1000 mg for patients less than 75 kg and 1200 mg for those greater than or equal 75 kg, administered orally in 2 divided doses with food. In patients with decompensated cirrhosis, the starting dosage of ribavirin is 600 mg and can be titrated up to 1000 mg for patients less than 75 kg and 1200 mg for those greater than or equal 75 kg in 2 divided doses with food. If the starting dosage of ribavirin is not well tolerated, the dosage should be reduced as clinically indicated based on hemoglobin levels. Do not chew Harvoni pellets. If Harvoni pellets are administered with food, sprinkle the pellets on 1 or more spoonfuls of non-acidic soft food at or below room temperature. Examples of non-acidic foods include pudding, chocolate syrup, mashed potato, and ice cream. Take Harvoni pellets within 30 minutes of gently mixing with food and swallow the entire contents without chewing to avoid a bitter aftertaste. No dosage adjustment of Harvoni is recommended in patients with any degree of renal impairment, including end-stage renal disease on dialysis. Before taking this medicine, you should not use Harvoni if you are allergic to ledipasvir or sofosbuvir. If you take Harvoni with ribavirin, this may be other reasons you should not take this combination treatment. Tell a doctor about all your medical conditions. To make sure Harvoni is safe for you, tell a doctor if you have ever had hepatitis B. You might be tested for this before you take sofosbuvir. Liver problems other than hepatitis, including a liver transplant, kidney disease, or if you are on dialysis, HIV or AIDS, a heart problem for which you take a medicine called imodiaron, or if you use a blood thinner, warfarin, Coumadin, Jantavin, and you have a routine INR or prothrombin time tests. Harvoni is sometimes used in combination with ribavirin. Both men and women using ribavirin should use effective birth control to prevent pregnancy. Ribavirin can harm an unborn baby or cause birth defects if the mother or father is using the medicine. Warnings. If you've ever had hepatitis B, it may become active or get worse while using or after you stop using Harvoni. You may need frequent liver function tests for several months. Harvoni is sometimes used in combination with other medication. Read the medication guide or patient instruction provided with each medication in a combination therapy. Do not change your doses or medication schedule without your doctor's advice. What to avoid? Ask a doctor before using an antacid or stomach acid reducing medicine. Use only the type and amount your doctor recommends. Using this medicine will not prevent your disease from spreading. Do not have unprotected sex or share razors of toothbrushes. Talk with your doctor about safe ways to prevent hepatitis C transmission during sex. Sharing drug or medicine needles is never safe, even for a healthy person. Harvoni side effects. Get emergency medical help if you have signs of an allergic reaction to Harvoni, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have new or worsening symptoms such as right-sided upper stomach pain, vomiting, loss of appetite or jaundice, yellowing of the skin or eyes, and not feeling well. If you take Harvoni and you also take a heart relief medicine called imodiaron, the combination of medicines can cause dangerous side effects on your head. Get medical help right away if you take this medicine and you have very slow heartbeats, chest pain, shortness of breath, confusion, memory problems or weakness, extreme tiredness, lightheaded feeling, like you may pass out. Common Harvoni side effects may include weakness, headache or tight feeling.